G'day, Tor here from Pro Stock Tips, and today I'll be talking about an exciting Australian biopharmaceutical research company called Invion, which is working on a breakthrough treatment for cancer. Okay, so as you can see from this slide, Invion's drug basically annihilates cancer tumours in mice. So they've implanted this mice with a triple negative breast cancer tumour, which is typically very hard to treat cancer, and their photodynamic therapy has annihilated the cancer. So it's triggered complete regression in the tumour, so essentially curing this type of cancer tumour in mice, which is very promising. Okay, so first thing you might be wondering is how effectively will this treatment translate from the mice studies to human clinical trials? Well, we already have existing photodynamic therapies which are used effectively to treat cancer in a variety of human tumours. Therefore, I'd be inclined to believe that this data that we've seen in the mouse studies could potentially effectively translate quite well into human clinical trials. Okay, so the next thing you might be wondering is how does photodynamic therapy actually work? So what happens is the photosensitized drug is accumulated within the cancer cell. Once it's in the cancer cell, then we activate that drug with an intense red light, potentially from an LED source. Once the drug is activated, it reacts chemically to release a reactive oxygen species. Now, reactive oxygen species are extremely damaging to the cancer cell, or any cell for that matter. However, remember that they're accumulated within the cancer cell. So it's very destructive to the cancer cell because the reactive oxygen species is highly reactive. And that's why it's so destructive and destroys the cell from the inside. Now, this will destroy the cancer cell and the surrounding tumour.
So your next question might be, why is this photodynamic therapy any better than existing photodynamic therapies? Well, one such advantage is that this is a very potent photosensitizer drug, with no toxicity issues identified up to 50 times the therapeutic dose. The high potency allows the drug to completely destroy tumours, and the low toxicity profile should make it much easier for the drug to get TGA approval. So what is next for the company? Well, they are continuing their preclinical studies, which could include testing against metastasized cancer, followed by phase 1 clinical trials in the second half. Will the treatment be effective against metastatic cancer? Well, we will have to wait and see. However, we can see from its fluorescent diagnostic properties that the drug does accumulate in the tumour deposits and their margins. So the treatment may potentially be effective against metastatic disease. Should you invest in Invion? Well, at this stage, that would be a purely speculative bet, as we do not yet have phase 1 clinical trial data in humans. However, there are potential upcoming catalysts which may increase the share price. If further preclinical studies are particularly positive, such as a complete response against metastatic triple-negative breast cancer, then that could potentially send the share price back up to 3 cents. Or once phase 1 clinical trials are announced, the share price may climb in anticipation of the results. Some important considerations to keep in mind. Invion does not own the underlying technology. However, they have licensed the technology for the Australian and New Zealand market and some of the Asian Pacific market. One positive, though, is that the innovator, which owns the technology, is funding the research. With a $115 million market cap, there's certainly some downside risk. However, if they do succeed in developing this drug, the upside reward could be very significant. I'll paste some links in the description, and I'd suggest subscribing for news alerts, as positive research or clinical data may present a trading opportunity.